I want to start with that. So, Lorraine, I'll let you introduce yourself a little bit and explain your experience with COVID and how you recovered from it.
Having already been tuned into health and nutrition because of keto, weight loss, and all that for a number of years, I was in a good spot for learning all the ins and outs of COVID and viruses and what to do. So early on, we started taking prophylactics, and I had started out with zinc, and then COVID came along, and everybody's like, hydroxychloroquine works really good as a prophylactic, but hard to get, got demonized. So started taking quercetin and added, we were already doing vitamin D, magnesium, things like that. Added in some other things along the way, vitamin C, read about NAC. Sometime around July, heard about ivermectin, but didn't take it as a prophylactic. So comes Thanksgiving, and my husband got symptoms first. I have no contact with anybody usually except for my immediate family. Hadn't had any contact for anybody in 2 weeks, but my husband goes to work every day. So he comes down with symptoms. 12 hours later, I start to come down with symptoms. Chills, body aches, no fever, surprisingly, with chills and body aches. Not sure how that works. But after about 3 days, we felt better, like all the way better. So I'm like, oh, good, we beat it. All those prophylactics worked. Well, the next day, day 4, I guess it would be, started getting mild cold symptoms, like upper respiratory, normal mild cold symptoms. I'm like, well, that's a drag, but no big deal, not very sick. Then things kind of kept going, got a mild cough, certainly nothing along the lines of bronchitis, really barely sick overall, very mild. I'm like, well, okay. So we get to the end of the week. All of a sudden, I realize I had no taste and no smell. You're down to your basics, your sweet, salty, sour, bitter, but no flavor. It's very odd. And I'm like, uh-oh. So now we're more sick. Should have taken the ivermectin a week ago. But it was so mild, we were kind of, it's like, yeah, we don't need anything else. It's just very mild. So took the ivermectin, and my husband completely over everything within 3 days. I, however, was not. So then I'm like, well, uh-oh. So I did the speak with an MD telemedicine and got the HCQ and Zithromax. The bad part about that is it takes a day or two to get the appointment, and then it takes a while to get it shipped from the pharmacy in Florida. I didn't get it for 4 more days. So I got all that on Monday, and you take it for a week, for 5 days, and that pretty much killed it. And I really, knowing more about how the virus is only replicating during the first week, I really don't know that it was the HCQ that did it that last week for me. I think it was the antibiotics. And I definitely had something going on in my lungs, cough, plus I could just feel it. And so I think it was the Zithromax that finally killed the end of it there. And then everything's fine.
And ivermectin is been around for years. In fact, when this whole pandemic came out, and back in the spring when they were talking about it, I had never heard about it for human use. The only use I had ever heard about it for was as a compounding pharmacy at Moses Lake Professional Pharmacy. We had compounded up ivermectin for veterinary use. Specifically, we had made it up for some dogs that had mange because it's a good anti-parasite. So I haven't done a lot more research on it since then, but there's been a lot more research done regarding the treatment of COVID. And I think that some doctors are using it prophylactically with great results. And just to get this out there, we are not recommending self-treatment necessarily and going down to a veterinary store and buying ivermectin. I appreciate your freedoms and what you did, Lorraine. I just want to make that clear to our viewers and listeners that we don't promote that. We want to make sure that you're going through the proper channels.